Masseter muscle. The masseter muscle is a paired, strong, thick, and rectangular muscle that is originating from the zygomatic arch and extends down to the mandibular angle. It consists of a superficial and deep part. The masseter is one of the muscles of mastication. It is a powerful superficial quadrangular muscle originating from the zygomatic arch and inserts along the angle and lateral surface of the mandibular ramus. The masseter is primarily responsible for the elevation of the mandible and some protraction of the mandible. It receives its motor innervation from the mandibular division of the trigeminal nerve. The blood supply is primarily from the masseteric artery, a branch of the internal maxillary artery. The classification of muscles of mastication refers to four main muscles, including the masseter, temporalis, medial pterygoid, and lateral pterygoid. The actions of the muscles of mastication open and close the mouth by influencing motion on the mandible. The four muscles separate into a superficial group involving the masseter and temporalis and a deep group involving the medial and lateral pterygoids. The masseter is a thick, somewhat quadrilateral muscle consisting of two portions, namely superficial and deep. The superficial portion, larger, arises by a thick tendinous aponeurosis from the zygomatic process of the maxilla and from the anterior two-thirds of the lower border of the zygomatic arch. Its fibers pass downwards and backwards to be inserted into the angle and lower half of the lateral surface of the ramus of the mandible. The deep portion, however, is smaller and more muscular in nature, arising from the posterior third of the lower border and from the whole of the medial surface of the zygomatic arch. Its fibers pass downwards and forwards to be inserted into the upper half of the ramus and the lateral surface of the coronoid process of the mandible. The deep portion of the muscle is partly concealed in front by the superficial portion, and behind it is covered by the parotid gland. The fibers of the two portions are continuous at their insertion. Tetanus toxin. Now, tetanus toxin comes from a gram-positive spore-forming bacteria, Clostridium tetani. Tetanus toxin enters the body, binds to peripheral neurons, and is transported retrogradely to the spinal cord of brainstem. Once inside the central nervous system, the toxin inhibits the vesicular release of inhibitory neurotransmitter glycine. Now, this disinhibition of low motor neuron leads to sustained contractions and muscle rigidity, including opisthotonus, respiratory failure, trismus, and dysphagia. And when trismus is the muscle rigidity and spasms primarily of the masseter muscle and the temporalis muscle, leading to an inability to open the mouth, leading to a smile characteristically called risus sardonicus. Masseter reflex. The masseter reflex, also known as the mandibular reflex or jaw reflex, involves opening the mouth and placing a finger on the chin of the patient and striking the finger with a reflex hammer. The downward force can cause a reflex action in the masseter muscle, resulting in elevation of the mandible. The normal response is very light or no reflex activity, but with brainstem lesion involving an upper motor neuron lesion, hyperreflexia of the masseter reflex is possible. Masseter muscle rigidity. Masseter muscle rigidity, also known as jaws of steel, occurs following a dose of succinylcholine and is defined as limb muscle flaccidity with jaw muscle tightness. There is a variable presentation from complete trismus and severe spasticity to a tight jaw response, which becomes concerning as the patient is unable to adequately be intubated, leading to an increased risk of malignant hyperthermia in the patient. Again, we will review the masseter, one of the muscles of mastication, powerful superficial quadrangular muscle with two divisions, a superficial and deep. The superficial portion of the masseter muscle originates from a thick aponeurosis on the temporal process of the zygomatic bone and the anterior two-thirds of the inferior border of the zygomatic arch. The anterior two-thirds of the inferior border of the zygomatic arch. The fibers of the superficial portion pass inferiorly, posteriorly over the deep portion and insert into the angle of the mandible, which is the masseteric tubercle, and the inferior portion of the lateral surface of the mandibular ramus. The superficial masseter muscle has a quadrilateral or quadrangular shape appearance on gross examination due to its origins and insertions. The deep portion of the masseter muscle originates from the entire surface of the mandibular arch. The entire surface of the mandibular arch. The fibers run inferiorly and insert along the mandibular ramus, superior to the masseter muscle superior portion. Anteriorly, the deep portion is covered by the superior portion of the masseter, while posteriorly, the parotid gland covers the deep portion. The masseter provides powerful elevation and protrusion of the mandible by originating from the zygomatic arch and inserting along the angle and lateral surface of the mandible. The temporalis muscle originates from the floor of the temporal fossa, inserting onto the coronoid process of the mandible, and contraction of which causes elevation of the mandible and retraction of the mandible. The medial pterygoid originates from two heads, the medial surface of the lateral pterygoid plate and the tuberosity of the maxilla, and inserts along the medial surface of the mandibular ramus. Contraction of the medial pterygoid is similar to masseter muscle, causing elevation and protrusion of the mandible. The lateral pterygoid also originates from two heads, the infratemporal crest and infratemporal surface of the greater wing of sphenoid and the lateral surface of the lateral pterygoid plate, and inserts at the joint capsule of the temporal mandibular joint, the articular disc of the TMJ, and the condylar neck of the mandible. And contraction of this muscle allows for protraction of the mandible and anterior movement of the TMJ allowing for the mouth to open. The lateral pterygoid is the only muscle to actively oppose the other muscles of mastication and allow for depression of the mandible. So herein we have had an in-depth review of the masseter muscle.